male factor infertility, that is oligospermia, morphology is less, or motility is less. Either of them. The male fertility thing involves all these three parameters. Remember, the count have to be in a range which is advocated by WHO, World Health Organization, that it has to have certain range. Why so many sperms are needed for fertilization? The reason is obvious. We humans are designed in such a way that the sperms have to travel a great deal of distance to fertilize the female egg lying somewhere in the fallopian tube during the fertile period, that is when the ovulation takes place in the female, right? So for obvious reasons, this is a nature's way of checking the survival of the fittest mode, that if you have ample number of sperms with good motility, it means that only few sperms will reach that particular oocyte or the egg of your partner and then be able to fertilize. If only imagine if God would have designed our bodies in such a way that you had a few sperms, say around 100 or 200 or 1000, what would have happened? They would have never reached the female egg at all. Why? There is a reality check at every point. The environment of the female's uterine tract from the vagina till it reaches her fallopian tubes is hostile for a sperm. It is not very conducive. The sperms which succeed in going through all the stages by going through the cervical mucus present in the cervix of the vagina, then into the body of the uterus, and then it reaches the fundus, that is the upper part of the uterus, and then the fallopian tubes, which are placed like this, right? They are bifurcated. You can see the diagram of a uterus, how they are. So this is a very big journey for the sperms, looking to the minute or actually what you call the micron, they're in microns, right? The sperms are microscopic in nature. Looking to the size of it, this becomes a Herculean task for any sperm to travel such huge distance. It may appear very small for we humans, but sperms are in nano microns, they're very small structures. For them to be able to traverse this path and reach the fallopian tubes and fertilize the egg is a feat. That is how our nature has designed that they are in millions in number. And why the motility is important is basically they have to travel the female's reproductive tract against the gravity. Her uterus is placed like this, upright, and once they enter her uterus, they have to go against the gravity and traverse all those chemical reactions and enzymatic reactions inside her uterus and reach the fallopian tubes. That is how the numbers are so huge in number. And then the motility is important because the faster the sperm can travel to her fallopian tube, the better the rate of success, better the success rate of conception. The reason being, progressive motility is one factor which we see when we see the reports of the patient. The reason is the most active sperms with the greatest speed succeed in fertilizing the oocyte for obvious reasons. The ones which are not going in that speed will dissipate and they may die in the journey itself. So progressive motility is very important when it comes to have a natural pregnancy. And the next part is why morphology is important. See, oocyte or the egg has to have certain amount of nutrients and certain pattern of anatomy with all the chromosomes intact. Similarly, the sperms also have the DNA or the chromosomes in the head of the sperm, which traverses the oocyte, and there is exchange of the chromosomes inside the whole thing, and then it leads to blastocyst and then the embryo and the further fetus, right? So there is exchange of chromosomes when the fertilization takes place, and for that you need a proper structured sperm. The head of the sperm has to penetrate the female's egg. There is something called acrosome, which is the head of the sperm, and this is very important part of the sperm because this is a part which penetrates the female egg. It is not any part. The head only can penetrate, and that is how the physiology of fertilization works. So the morphology is important because morphology is nothing but the structure of the sperm, which is capable of uh, getting the right product, that is the embryo. If the morphology is not in place, if the structure is not in place, if it's anatomically not proper, it means that there is some defect in that sperm. As simple as that. WHO, the body which decides about the normal parameters for the sperms throughout the world, advocates that at least 4% of your sperm should have normal morphology. At least 4%. The higher, the better. That is a lower range. When people ask, sometimes with a lower, if the sperm count needed is 15 million per ml, that is what the WHO says, out of which, if you are having only 15 million sperms, and then if the morphology is somewhere in between 4 to 6 or 4 to 9, whichever, then it's very easy, provided other parameters like progressive motility is also in place. But if you are having low sperm count, say around 8 to 9 million or 10 million, which is again a thing to challenge to fight it out, because you need to have normal amount of sperms for having a proper natural conception. But then if your morphology is not in place, that is the structure. Just imagine you are having hundreds and thousands of sperms, but they are not of any use. Morphology is nothing but the basic structure of the sperm, the how it functions, without which there is no success at all. You are having all the sperms, but they are futile. It's like you're fighting a war with wounded soldiers. They're not able to do any work for you. That's it. The numbers are seen. There may be thousands of soldiers, but they can't fight for you. Similarly, if the sperms are not morphologically normal, then it means they are not able to fertilize the egg, no matter what you do, no matter what. So this is in relevance to a message I got on my messenger recently when I was talking to one patient of mine who had a failed IVF, maybe, or failed IUI. Many messages I get, out of which these questions are like, why the IVF is not successful, why IUI is not successful. What you need to understand is, no matter what technique you use, the sperm parameters have to be somewhere in normal. They do something called washing of the sperms, pre-wash sperms during the IUI techniques, or IVF, they take the best quality of the sperms. But the nature says that the sperms which are normally in the normal parameters have higher rates of getting the success in fertilizing. The only reason being, the sperms which are able to fertilize the egg naturally would have survived the hostile environment of the uterus and reach the fallopian tubes and then succeed in fertilizing the egg. So it is a test, it is a litmus test by itself. The whole process of going through going through that reproductive tract of your female partner and reaching that fallopian tube and fertilizing the egg. So when the sperm can survive the whole process from here, point A to point B, that is the egg, that it would have gone through so much of challenges. So it is just as simple as that. The survival of the fittest is the theory here. So the number is very important, morphology is also very important, but does it mean that only 4% of morphology is enough? The more the merrier. If you have 9, 10, 11, 12% good morphological sperms, it's more easier. And if your if sperm morphology is lesser than 4%, and still if you're opting for any of the artificial techniques like IUI and IVF, why not correct them before going that, for having better success rate? And just come to the causative factors of these in a short while. What may be the potent stressors or potent sperm destructive mechanisms which may be happening in your body, with your knowledge, without your knowledge? When I get a couple of messages saying that my spouse is not a smoker, nor an alcoholic, and why is this report so and so, there are hundreds of reasons, out of which I will just run you through the few of them, a couple of them in this video and in the subsequent video next week. So I am referring a research article from a very good medical journal for my reference, to just give you some facts and figures when it comes to male fertility thing. Semen quality represents a compelling factor for fertility, and de-alienating the normal values has proven difficult. In the last decades, it is seen that there is a decline in the sperm parameters. Many authors have written on this. The reasons are obvious. Let us go through one by one. When there was an investigation taking place as to why the sperm counts have fallen down in the past couple of decades, it was seen, it was observed by WHO, and certain theories were proposed, like what may be the factors, out of which very potential factors have to be, can be a poor diet, increased obesity, exposure to environment toxins, change in environmental conditions, and more very important environmental conditions like exposure to endocrine disrupting chemicals. What are these? Endocrine disrupting chemicals are very important. What you need to understand is endocrine system is a basic need for your testosterone hormone to function normally, without which the sperms cannot be produced normally. So for your testosterone to be produced normally, your endocrine system, that is hypothalamus pituitary axis, HPA axis, what we call, it should be in place. And these endocrine disrupting chemicals are ones which will hit your axis in these areas, and then there may be some fluctuations in your testosterone levels, and then thereby also it may lead to abnormal sperm parameters. Some of the endocrine disrupting chemicals can be your pesticides, the herbicides, a very important chemical called bisphenol, phthalates, heavy metals, and many other things which are the pollutants in and around us, including some vital air pollutants, water pollutants, food pollutants, and metals. So, what happens? How do you get exposed to this? It is just not now. You may be some in the age group of 30 to 45 and things like that, who are trying to become a father, but this exposure may happen even prenatally. When you were in the womb of your mother, the exposure would have happened then also, without, of course, you have discovered it because now you're on your path of becoming a father, right? So this heavy metals or this exposure can have happen from prenatal life and continuing into your adulthood, and it may be a probable feature for explaining the reduction of the sperm parameters. Therefore, this particular article, which I'm going through, summarizes the whole spermatogenesis, that is the production, that is the physiology of how the sperm is produced, and then to go with the depth of why there is a global human sperm quality decline. Sounds interesting, isn't it? I had saved this article some time back, and then today I wanted to talk to you all about the actual impact, why the male factor infertility is such a challenging thing, and how to get over with it. That only you can understand when you're able to understand the causative factors. So I wanted to go into depth of the causative factors. Unhealthy lifestyles like smoking, alcohol, and other lifestyle factors. Today I would like to talk about more emphasis on smoking and alcohol to some extent. So what is understood worldwide is the known cause of male fertility factor is, the compromises in the male sperm quality is due to smoking. Some other factors like diet, obesity, alcohol consumption, pollution, and all those things are there, but then the main factor is been zeroed to cigarette smoking. Cigarette smoking is identified as a worldwide health problem that contributes to different illnesses and is a cause of many other problems. Data suggests that smoking, especially in the preconception time, might negatively impact something called DNA methylation patterns, causing, not to worry about the medical terms, thus causing sperm DNA fragmentation and aneuploidy. This is relevant to people who are going for IVF and things like that. This is a reason for aneuploidy, in the sense, when you fertilize the egg and the sperm even outside in the laboratory environment, if the DNA is carrying some impact of the whatever damages must have happened due to smoking, then it may reflect in the blastocyst, and the embryo may be not viable for the pregnancy further. So a mod just yeah cigarette smoking has been associated with an infertility risk factor and is strongly associated with male sterility. About 40% of the studies says that when the number of cigarettes were increased in the person, the fertility rates fell down to nearly 60 to 70% in their whole lifetime. Smoking also exerts its greatest negative impact on the genome integrity, and there are almost 70% of international publications which have reported that some level of smoking related damage happens to the genome and epigenome, which might raise the rate of chromosomal aberrations. Why again this is important is, for people who are going for natural conception also, I would really advocate that you correct your lifestyles first by weaning the body of all the toxins which must have impacted your fertility at some point of time. For example, I have many people telling, my husband was a smoker for 5 6 years before, and now he's quit smoking for the past 3 4 years, and still we are not able to conceive. So the impact which has happened at the microcellular level, at the testicular level, at the DNA level is so severe that even if you are quitting the smoking, you can't reverse the effect immediately. It takes a while, and for that you need a nutritional support, as well as very good herbal medicines are available. But for that you have to take some proactive steps, right? So why this supplements work for these people is, they will change the, or they will reverse the damages which have happened in the cellular level, and it is a process by itself. It cannot happen overnight, it cannot happen within few months, it may take a year or two if the damage is too much. And what is the only test to understand this is called sperm DNA fragmentation test, which is considered to be mandatory in the IVF process, but some doctors don't believe in it, and then they go ahead with the fertilization, they go ahead with all the therapy, and when there is any kind of miscarriage or any kind of failure of implantation, then there is, this becomes mandatory for the couples to do, to understand why the success rate or why the IVF is not working for them, right? So most tobacco products contain around 4,000 different chemicals and constituents, including nicotine, heavy metals, and something like cadmium and lead have been individually linked to impair sperm quality, as smoking in general is considered. Smoking appears to reduce sperm concentration. What smoking impacts? It impacts the count, concentration, motility, viability, and the normal morphology. So it means it impacts all the parameters. And it also is associated with DNA damage and leads to the generation of something called reactive oxygen species. What is this? This is nothing but the impact of smoking, what is given on the body. It reflects in this way that these parameters are increased. This is called reactive oxygen species. You can consider them as toxins in layman's terms. The impact of nicotine on the body is reflected in this parameter, and when you conduct the sperm DNA fragmentation test, there is a special test uh, which will point out the actual reactive oxygen species, how much it is there in your sperms. That is actual amount of damage you can find out. Science is so advanced, you will even understand how much the damage is done. It is given in the percentage. 0 to 15 is considered normal, 15 and above is considered, 15 to 30 is 25 is considered moderate, and 25 and above is considered severe damage. So when I have seen so many patients even having IVF failure, it becomes, it has become mandatory for me to at least ask for them, why not get your DNA, sperm DNA fragmentation test done, because that is something very easily forgotten, but it may be a cause for the early miscarriages or implantation failures. The reason being obvious, the sperms are of not good quality. So, just to reiterate the fact, for a healthy embryo to come into existence, you need a healthy egg and a healthy sperm. There are no two rules about it. There are no two thoughts about it. So it is mandatory for both the partners to work equally on their bodies to bring about that optimal health of the sperm and the egg. Though you are battling with male factor infertility, still the female factor also may impact. So even if you may be having a normal female, uh, uterus or female eggs or whatever, but is there any parameter to measure it? Not necessarily you need to measure it. It is something you need to understand. Reproductive system is nothing but a reflection of your whole health. If something is not working, just like any other systems, for example, if your liver is not working properly, you will understand what may be the causes. Similarly, if your reproductive system is not working in place, then it means what may be the causes for not working. Find out those causes and work on them, and then you can succeed in whether it's natural conception or artificial reproductive techniques. What you need is a good quality sperm and a good quality egg. But there is one important thing when it comes to smoking. Here the authors have reported that there is something called cadmium and lead, which are byproducts of smoking, which are introduced into blood, were significantly increased in the male factor fertility males who are suffering from this. There is an adverse correlation which was found between seminal concentration of cadmium and lead and sperm numbers, motility, and abnormal forms. What it means, this can be used as, how much of this lead and cadmium is present in the semen can be also an indicator or a test to find out how much of impact the smoking has done on your body, because semen is a kind of a fluid which is given out of the body, ejaculated of the body, and it is a body fluid. And just like how your blood is an indicator of your health, your semen can also be an indicator of your health. We test semen analysis only when we are in the process of getting the baby and the fertility issue has happened. But sperm can also be an indicator, semen can also be an indicator of what must be the impact of the smoking and things like that, because it is a body fluid. Just like how we take the x-rays to see whether you are having any respiratory infection or things like that, even by looking to your semen you can understand your body condition, what impact your smoking must have had in that. So this cadmium and lead levels is again an indicator which can be done. It's a very specialized test. Many doctors don't do it. It's very difficult to get it done, but it can also act that way. One of the main mechanisms involved between smoking and semen impairment seems to be an increase in ROS, which I told, reactive oxygen species. Cigarette smoking represents a source of pro-oxidants and free radical generators, which can induce oxidative damages and reduction of redox scavengers in the peripheral blood. This is a little deep one. Let me go again with something simple. Another concern greatly studied in male factor infertility is represented by DNA damage in the male germ cells, which can be associated with damage to genetic integrity, a reduced, just listen to this very carefully, how it may impact. It may impact the genetic integrity, a reduced fertilization rate, poor embryo development, and increased risk of miscarriage. Even so, the specific details of DNA lost integrity are not well elucidated. However, it seems that it is highly associated with DNA compaction during the final stages of spermiogenesis and damage induced by oxidative stress. So, to make it very simple, whatever impact has happened to the sperm at the DNA level reflects in many stages of fertilization. One, the fertilization may not occur at all, so there is no conception happening. The fertilization may occur, but there may be some problem with the implantation. For example, for people who have had IUI or IVF, in there the implantation may occur, maybe 5th or 6th month there may be disruption in the whole system and there may be miscarriage, or there are many stages, so to say. So and also during the spermiogenesis, what is spermiogenesis? It is a physiological process through which the sperms are produced in your testicular tissue. So this DNA thing affects the whole production at that level only. That is even at the testicular level. So it starts with the male's body, but it ends up in the female body when it is reflected in the process of fertilization and the implantation. So you can imagine, if you, it is a little bit too straight to tell you, but it is needed. If you want to have a healthy baby and see the genetic chromosomes in the baby's body is normal without any major problem later, then it is high time to consider your habits, smoking being one of them. However, one investigation also reported that teratozoospermia, that is a motility issue, was found in 63% of males who drank. This is related to alcohol. I would like to highlight alcohol also in this video. Motility issues was found in 63% of males who drink alcohol moderately and 72% of males who drink alcohol heavily. And also 64% of heavy drinkers had oligospermia, that is that is abnormal sperm counts, that is lesser sperm counts, having lower than the normal. And it was also found that alcohol might impair male fertility by damaging the, how this happens, the mechanism of alcohol, how it affects the sperm production. Alcohol might impair male fertility by damaging the anterior pituitary gland, causing the alteration of the hormones which are responsible for reproductive function, like LH and FSH, that is luteinizing hormone and follicle stimulating hormone, and by interfering with the hormone production of the hypothalamus. You remember I spoke about HPA axis, that is hypothalamus pituitary axis. This is very important for all the hormones, including testosterone. Even the LH and FSH is also impacted by this. So the whole mechanism of the pituitary gland and the hypothalamus gland and the testicular tissue getting the whole, signals from them as to produce testosterone, so the sperms are produced. The whole thing gets disrupted when you are having excessive alcohol. And then this is how the testis, in the testis, how it alcohol might impair the function is, it may impair the function of something called Leydig cells. Leydig cells are the cells which produce testosterone, which is a male, most important male hormone. In addition, alcohol also may induce dysfunction in the Sertoli cells, which play an important role in sperm maturation. You need to understand two things. One is the Leydig cells, one is the Sertoli cells. What is the function of Leydig cells? Leydig cells are important for testosterone production. And why testosterone is needed? Testosterone is needed to stimulate the sperms production. And Sertoli cells are what? Sertoli cells are place where actually the sperms are produced. So these both the cells are equally important, and both the cells may be equally harmed due to the excessive alcohol in your blood. So the reduction of the seminal fluid volume and sperm number has been observed in males with high consumption of alcohol, with a reduction in testosterone levels and normal LH and FSH and prolactin. I mean, I'll not get into the details of this, but the whole scenario is that if you're a smoker and if you're into heavy alcohol, then no matter what you do, whether it is natural conception or you're going with your artificial techniques, getting success is very, very challenging. The reasons I have told you, because they impact the DNA integrity of your sperm cell. So this is what I had to offer for you all today, and thank you everyone who's been watching me live patiently for the past 20-25 minutes. If you have any questions, please comment in the comment box. I'll be more than happy to answer them for you. And this is what I have decided for the past 3-4 weeks. I have been going live on Holistic Fertility Hub every Saturday evening, 5:30 Indian Standard Time. So make sure you be here and take as much as information as needed for you in your fertility journey. And if you want to start your fertility journey with holistic methods, please feel free to reach out to me. Thank you for watching. Thank you for the patience you have had. And I'll be very happy if you want to make it interactive. You can always post your comments during the live session and get your queries resolved here itself during the live session. Thank you. Have a nice Sunday tomorrow.